Hi, my name is Clifford Hudis, and I am the CEO of the American Society of Clinical Oncology, as well as the host of the ASCO in Action podcast. About twice a month, I interview thought leaders in healthcare and experts in oncology, and we provide analysis and commentary on a wide range of cancer policy and practice issues. You can find the ASCO in Action podcast on Apple Podcasts or wherever you are listening to this show. And you can find all 9 of ASCO's podcasts, which cover a wide range of educational and scientific content and offer enriching insight into the world of cancer care at podcast.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines podcast series, brought to you by the ASCO Podcast Network, a collection of 9 programs covering a range of educational and scientific content and offering enriching insight into the world of cancer care. You can find all the shows, including this one, at podcast.asco.org. My name is Brittany Harvey, and today I'm interviewing Dr. Sharon Giordano from MD Anderson Cancer Center and Dr. Michael Hassett from Dana-Farber Cancer Institute, co-chairs on Management of Male Breast Cancer, ASCO Guideline. Thank you for being here today, Dr. Giordano and Dr. Hassett.
Thank you.
Yeah, thank you. Glad to be here.
First, Dr. Giordano, can you give us a general overview of the scope of the guideline and how you identified areas in which the approach to the management of breast cancer for men differed from the approach used for women?
Sure. So overall, we wanted this guideline to be a comprehensive guideline covering aspects of management of male breast cancer. However, we did recognize that there were areas where the treatment was likely to be quite similar between men and women who develop breast cancer. And so we approached this in 2 phases. In the first part, we surveyed our breast cancer guideline advisory group and really asked the group for a bunch of different aspects of treatment, if they agreed that the treatment was same between men and women, and whether they felt that this was an important topic to address in the guidelines. And so from that process, the advisory group determined that on the whole, that they felt that the surgical management, chemotherapy in the adjuvant setting, and for advanced disease, radiation, and the use of gene expression profile testing was similar enough between male and female patients that we didn't need to separately address this in the guidelines. And so based on this, we were able to identify 5 main areas for the expert panel to focus on. And these areas included the adjuvant endocrine therapy for men with breast cancer, the endocrine therapy for men with metastatic breast cancer, the adverse effects of endocrine therapy, germline genetic testing, and survivorship. So these were the areas that we really focused the heart of the guidelines on.
And Dr. Hassett, can you go over the key recommendations outlined in this guideline?
Of course. With those specific topics with endocrine therapy in both the adjuvant and the metastatic setting, the guideline recommended for tamoxifen as the first therapy for men. There are other endocrine therapies that are often used in women, but there is less evidence that these therapies are effective in men who have estrogen receptor positive breast cancer. With regard to genetic testing, the guideline recommends 4 genetic testing for inherited risk factors as a routine course of practice for men with breast cancer. And then with regard to survivorship care, ipsilateral surveillance mammography is recommended for men who have been treated with lumpectomy, though certainly isn't needed for men who have been treated with mastectomy.
And what are the recommendations on targeted therapy?
For men who have specific targeted alterations such as HER2 or PD-L1 or PIK3CA or a BRCA mutation, the same treatments can be used in men as are used in women, with no different indications or combinations.
And why is this guideline important, and how will it change practice?
this guideline's important because male breast cancer is such a rare disease. So a lot of clinicians and providers have not treated a lot of cases of male breast cancer, and the evidence is fairly sparse as to the optimal management of men. So, I hope this will be helpful guidance for men as they take care of male breast cancer, given that it's a rare disease. And I think it may also help to standardize practice so that clinicians can feel confident and comfortable with their approach to treating men with breast cancer.
And finally, how will these guideline recommendations impact men diagnosed with invasive breast cancer?
Picking up on Dr. Giordano's comments, I hope that these guidelines will help improve the consistency and the quality of care that's provided to men. As she had alluded to, male breast cancer is not a very common thing, so the awareness amongst oncologists of how to approach this cancer, it's not as high as with other types of cancer. I also hope this guideline can be used as a way to highlight opportunities for future research. We know that there are still some unanswered questions for men with breast cancer, and through this guideline, we highlight the areas where we think differences in men and women could exist and where additional research studies could help address some lingering questions around the treatment of breast cancer in men.
Thank you for your time today, Dr. Hassett and Dr. Giordano.
No, thank you.
Thank you. I enjoyed it.
And thank you to all of our listeners for tuning into the ASCO Guidelines podcast series. To read the full guideline, go to www.asco.org/breast-cancer-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, available in iTunes or the Google Play Store. If you've enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.